Come on up. I just wanted to, a little more background. Dr. Solomon Orero is an obstetrician and gynecologist, more than 20 years practicing in the field of family planning and reproductive health training programs in all of Eastern Africa, especially Kenya. He served as a senior reproductive health technical advisor for Pathfinder International and is the founder of Kisumu Medical and Educational Trust. Dr. Orero, as you know, will talk about the impact that U.S. policies and the restrictions are having in Africa. Dr.
Orero. Thank you very much, Daniel and Kathy, for those nice words. It was once said that he who travels far with an open mind, open eyes, and open ears learns a lot. It has been my privilege in the exploits of my travel throughout the globe in Asia, Europe, America, and Africa in particular, to have learned a lot in the course of my duties that have been explained by Kathy. I have noted with a lot of admiration at the magnanimity of the African woman's heart. The African woman, in pursuit of sustaining the human race, has been made to believe her role is to reproduce. She has been made to believe she has to shoulder that role and the burden of reproduction and the consequences without any complaint. She has been made to believe that in that process, she must produce more males, and if she doesn't, then that is her mistake. She takes it all and can still afford to smile. To crown it all, even the biblical mythology has been interpreted by the males that she is subordinate to the male. Ladies and gentlemen, before I came here, I had the misfortune to see and take care of a woman, 38 years old. She was pregnant with her 15th child. She came with obstructed labor. She arrived late. She had ruptured her uterus. Because of the delays we have in executing emergency services, we did not have blood. Theater was not ready. We had a few things missing. We lost her while watching. She left 14 children, 7 boys, 7 girls. What annoyed me most, why did she have to deliver that 15th child? Did she really need it? She was not there to answer that question. But between you and me, given a choice, given a privilege, given ability, she would not have gone up to the 15th child. She would have done something about it. When we were auditing her death, many times she cried that she has the burden. She couldn't access a fertility regulation. Ladies and gentlemen, that is just but one. Like Daniel mentioned, a number of years ago, we had a very thriving family planning program, which was supported, which was managed from support from the US. Unfortunately, my country, as I speak to you today, even with the full knowledge of the benefits to the society, to the country, to the community, to the family, to the woman, and to the children, my government, only the last 1 year, was able to give a token budget of 0.6% of the Ministry of Health budget to reproductive health programs and family planning. That is, as I mentioned, a token. It didn't do much. it doesn't do much. It is interesting to note that women all over the world, and women will bear me witness, given a chance, would like to have the number of children they can comfortably care for, the number of children they can comfortably look after, and the number of children they can look at who are healthy, who are growing up well. A lot of the time, they are forced onto quantity rather than quality children. In the course of my work, and this is, you can check in the internet anyway, walk into any hospital in my country, walk into a gynecological ward, you'll find that between 50 to 62% of the women admitted in those wards are admitted because of complications of unsafe abortion. Unsafe abortion occurs because a woman has had a pregnancy she didn't intend to have, she doesn't intend to have. In my practice, I'm yet to come across a woman who goes out to conceive willingly and then willingly goes out to remove that pregnancy. No woman in her right senses will go out, plan, have a pregnancy, and then plan to remove it. That woman does not exist. However, on the other end of the stick, any woman who for one reason or another conceives an unwanted, unintended pregnancy and decides that she is not going to keep that pregnancy, will remove it, even if she is dying in the process. Unfortunately, in countries like mine, where abortion services are restricted, a lot of the time it is done, that removal is done by people who do not know what they are doing. They do not know how to remove it. The consequences are a lot of women die from it. Last month, in the teaching hospital where I was doing a training of health providers on how to manage women who have suffered complications of unsafe abortion. In the ward, we had 3 women who, because they had unsafe abortion, we had to remove their uteruses, we had to resect and anastomose some of their intestines, and we had to create a bypass for them to pass stool, what we call a colostomy. That was last month. I was doing for some work for Pathfinder. We were training providers on how to manage unsafe abortion. These are consequences which, one, they are by and large arising because a woman did not have access to family planning services. Ladies and gentlemen, looking at all that, you deny a woman fertility regulations, she will have unwanted pregnancy. If you force her to have a pregnancy, the chances of her death in the subsequent pregnancies are high. Complications in pregnancies increase by the index number of the pregnancy. In fact, in certain parts of the countries where I come from, a woman who conceives has signed her death sentence. Thank you very much.